Hi, my name is Victor Wong, and this is a presentation about rubella. Where does this problem exist in society? In the United States, this contagious disease was eliminated in 2004, but despite that, it still remains problematic worldwide and can be brought into the US through travelers who come from at risk countries. As a teratogen, it leads to birth defects such as deafness, blindness, abnormal heart development, and cognitive disabilities such as mental retardation. How and where did this happen? It was first discovered by German literature in 1814 and was thought as measles. It was later found to be not similar to measles at all. But in terms of America, it didn't really become a problem until the early to mid 1960s. Rubella is generally spread by direct contact with with the nasal or the throats of the infected. One of the major symptoms is a noticeable rash that occurs approximately a week after the initial contraction of the disease. But 25 to 50% of cases never really show any signs of symptoms. What risks will occur in the future? Well, rubella is no longer a true threat in the United States, but it can still be brought by travelers who are coming into the country from at-risk countries. Despite that, less than 10 people in the United States have rubella yearly, and that's generally due to vaccinations. Vaccinations keep people safe through immunization, and that means people really need to get vaccinations, or the herd immunization really makes the effectiveness a lot less powerful. So, what are the etiological factors? Well, the major etiological agent is known as the rubi virus and was, again, first discovered by German literature. It was thought to be measles, but it was proven otherwise. Despite that, it's still relatively known as German measles. Its reservoirs are people. So children in unvaccinated populations are really reservoirs for building these kind of diseases, and adults and adolescents in vaccinated populations can breed the disease as well because of the fact that they are a lot stronger and able to allow it to grow. So, what are the possible strategies? There really is no specific treatment for those who get infected. So, one of the major things they should be doing is they should be isolated from any environment susceptible to spreading infections, such as schools or places of work, and anywhere with a lot of contact with other people. And for those that do get infected, rest and fluids are really best suited for them because it helps their body kind of fight off the infection. But the best way is through prevention. If there's a lot of vaccinations for it and there's a widespread usage of vaccination, then it really helps immunity because it makes each individual person a lot less susceptible to getting the disease, which really helps in general with the stopping the spread of the disease. So, how has rubella been treated before? Well, the United States first implemented the vaccination in 1969, which caused massive rates of rubella cases being reduced in the following years. However, there was a bit of a spike in the mid 1990s from the Hispanic young adults, and that was generally because they came from Latin American countries that didn't really have vaccinations. But because of this increase, a lot of Latin American nations actually began to implement vaccinations, which decreased the number of rubella cases in the following years. So, what can we do for future prevention? We have to ensure that rubella vaccinations remain mandatory for schools and that there's a lot of proper education on rubella. This is important because that really decreases the chances for rubella to even spread. Um, Regardless, I feel really strongly about stronger vaccination regulation because there are too many anti-vaxxers, and I really think that there should be none because those who don't believe in who believe in vaccinations really decrease the overall immunity of the public.